Hello, my name is Eric Duke. I served 8 years in the U.S. Navy as an orthopedic technologist. I've also been working at my current facility, a large medical facility, for 24 years. I'm also an instructor at Grossmont College for the last 6 years. I'm a board member of the AOTC. Over my last 30 years or so, I've learned a lot of techniques to apply a Muenster cast, which I'm going to show you today. How to apply a Muenster cast properly, the correct techniques. And through those years, I've learned a lot of techniques that I think will be helpful for you today in this video. Let's get started. So let's cover the materials we're going to need for a Muenster cast. I'm going to start out with the stockinette. I typically like to use 3-inch stockinette for a normal size adult. Again, all the materials I'm talking about here for a normal size adult. You might have someone smaller, someone bigger, but for a normal size adult, a 3-inch stockinette, you're going to need quite a bit of it. And I'm going to show you why towards the end here, or towards the casting video. That's going to be followed by some padding web roll. You can use a roll of 2, a roll of 3. I find 2 rolls of 3 works the best for me, but again, that's for a normal size adult arm. Again, you can use different sizes if you need. I then follow that by 1 roll of 2-inch fiberglass tape. Then a roll of 3-inch fiberglass tape will be for the forearm and the elbow. Once I do my cutbacks and my rollbacks, I'm going to finish it with 1 roll of 2-inch fiberglass. Again, this is for a normal size adult arm. I always have my pin. When we do our cuts around the elbow, we need to have our Sharpie. I have it ready to go. I've been doing this 30 years. I still use a Sharpie. It's just easier to do. And these crazy things, you know, like a stapler. What would you use a stapler for? Well, you're going to see that in the video here pretty soon. It's pretty cool. You're going to like it. And of course, we use darn gloves, you know, but you got to use gloves as well. Okay, now let's talk about why you're putting the cast on, what the parameters of the cast will be, and how it's supposed to look or how it's supposed to function on the patient. First, why is the cast applied? Generally, this cast is going to be applied because you've had a wrist fracture or a mid-forearm injury. And what we're trying to do with this cast is prevent or reduce the amount of pronation and supination in the forearm and the wrist. That's why you're treating a mid-forearm and or a wrist fracture, okay? So, parameters of the cast. At the distal end, at the back side of the hand, it should be at the metacarpal heads or just below the metacarpal heads, at the distal end on the dorsal side. On the palmar aspect, it should be at the distal palmar crease. No further up. It should allow full flexion and extension of the fingers and normal range of motion of the thumb if needed. At the wrist itself, again, this is not talking about reduction or anything like that, but a normal cast with no extra weird motions. You want wrist about 10 degrees of extension. I'm going to roll the hand this way a little bit. You don't want any radial deviation or ulnar deviation, so neutral wrist rotation or angulation. And then forearm generally be neutral. Again, some providers may want you to be in a little bit of pronation or supination. That's based on the injury, but for the most part, we're going to teach you just a standard Muenster cast. That's at the proximal side. Sorry, at the distal side. At the proximal side, you're going to have it about 2 fingers below or distal to the antecubital fossa. This area here. The cast needs to go above both lateral and medial humeral condyles. If I'm the humerus, you come down past the farmer's hand here, and you find the humeral condyle. Has to be above that, or it's not going to work properly. And then lastly, in the very back of the arm, you have your olecranon. The cast needs to be above the olecranon, or proximal to the olecranon, to prevent extension of the elbow. If you can extend your arm all the way, you cannot prevent pronator and supination. So the cast has to prevent you from going to extension. So the original documents say 120 degrees of flexion to about 60 degrees of extension. That's all. Not 45, not 0. It's going to be 120 to about 60. That's what we're looking for here. And to reduce the amount of pronation and supination in the wrist and the forearm. That's the goal of this cast. Now I'm going to show you some techniques to make this work better, how to apply it properly, but that's the goal of the cast. Okay, now we're going to apply the cast. So again, we start with our first thing, our first layer next to the skin will be stockinette. I'll start with the thumb sock first. I'm going to go around one of the edges, one side, cut about an inch, inch and a half up. Again, sorry to start with, the patient's arm should be about 90 degrees at the elbow, maybe a little less than that, but not less than 60. So somewhere between 80 and 90 degrees. I'm going to put my stockinette on the thumb first. My next stockinette. This is going to be really important in the series of how you do the stockinette. The longer stockinette has to go first. There'll be 2 stockinettes on the forearm. The longer one goes first. So this is going to be like you'd normally do a cast. Cut a small hole for the thumb. When you have a guy really big forearms like this guy here, we have to really make sure we make a big stockinette there. Remember, the cast is going to go past the elbow here, so we need to make sure we get the stockinette really far up there. We want more, not less. Again, bring the arm back down again. Here's our second piece of stockinette. No cut for the thumb. This stockinette is going to go mid-forearm, the same height up on the humerus. You'll see what this second piece is for at the end, or after we cut the cast back. So again, second layer, styloids, and up. So 2 layers of stockinette right here. That'll come into play at the end. Make sure you don't have any wrinkles. And now we're going to start our cast. Again, wrist not too ulnar deviated, radial deviated, neutral there. Wrist back a little bit. Forearm is going to be neutral. Start with my web roll at the wrist. Go to the hand. Be mindful of your parameters at the distal part of the cast. We don't go too high. 2 layers. Up the forearm. You can tear it a little bit when you have a bigger forearm like that. It kind of where it lays down. If you kind of see I'm doing that, I'm just kind of taking the web roll and twisting it a little bit. It helps it lay down more normally. You stop here for 1 second. I do my distal parameter next. I'll tear this just a little bit. Cover the end of the cast. Again, this is my motion here. I want to pad this area right here, even though they're not going to pronate and supinate too much in the cast. I still want to pad it because they're going to have a prominence there. And now I'm going to turn my attention to the elbow itself. I get my second roll of material, or web roll. I have the patient bring their arm up just a little bit, maintaining the flexion of their elbow. We don't want them to extend too much. Keep the elbow flexed. Start where I stopped, and come on up. Go a little higher than you think you might need. You're going to cut a lot of this off, but you want to go a little higher than you think you might need, just so you don't make it too short. Most of your rubbing or your irritation is going to be around the elbow here, so you want to put a few layers of padding there to make sure you pad it fairly well. One more around the condyles. You make sure the elbow is not too extended. Back down. And now we're going to roll our fiberglass material. Like I said earlier, I'm going to start with a roll of 2-inch, then move to a roll of 3-inch. This will be at the very end, so that'll be held onto. These 2 rolls first. Don my gloves first. Last check of the wrist and arm. Patient will move on you. Start the roll of 2-inch, same spot at the wrist. Grab your scissors. Do your cuts around your arm. Your thumb. Like you normally would with a short arm cast. So I really look at this cast as basically a short arm with a little longer short arm. in the sense of rolling the cast up at the distal end here. It's not really much different than that. I'm gonna go down the arm. I'm not gonna go all the way to the elbow. I'm gonna go up to the arm, high as I can, but leave the arm down for right now, and come back up the forearm. I'm gonna roll my distal stockinette back right now, because once I pass this part and I roll my next roll, I really need to concentrate on my mold. So I don't want to be thinking about this when I'm trying to mold the cast. Make my cuts. I have plenty of time right now. My parameters look good. Distal palmar crease. Back of the hand. Now I'm going to go my 3-inch roll of fiberglass. Mind you, again, this is a regular adult male. Like with the red ball, I'm going to have the patient bring their arm up in the air. I'm going to start where I stopped, go up the elbow. You need a lot of strength here at the wings. I'll talk about what the wings look like in a second. So you kind of want to do this. We don't like to talk about pulling the material, but this is one area where you can pull just a little bit. Again, it's kind of a technique. Know what you're comfortable doing, but I'm going to pull just a little bit and really concentrate on the elbow, at the condyles of the humerus, back and forth. When I think I have enough, I can take this material and roll down the forearm to finish it off so it connects the two casts together. Now I want to get to my molds. I talked about, here's your condyle of your humerus. You have one lateral, one medial. That has to be molded. Clearly, we know that. What I really think helps, and what I'm going to teach you today, is really molding the whole forearm. Doing a very aggressive, when I said aggressive, very aggressive interosseous mold. If you're at home right now and you have someone next to you, take both of your hands and squeeze who's with you, their forearm. Then tell them to try to pronate and supinate their forearm or their arm. They cannot do it. So if you want to concentrate just this mold up here, what happens is, as they start to rotate their forearm, these are the only things holding that. It starts to hit on both sides of the humerus. It's very uncomfortable if you ever wore this cast. So if you can concentrate on the mold all the way down the forearm and at the elbow, both, it really makes this cast fit a lot better, but functionally work a lot better. I think that's a real key to this cast. What I've learned to do better, or that's one of the techniques I picked up from one of my coworkers, is really talking about molding the forearm. Like I said, when you get back to work your next day, or if you're at home near somebody, just literally take your hands and do a big interosseous mold. Then tell the person next to you, pronate and supinate your forearm. They can't do it. Try it. Protects it. You're getting this mold all the way up. So you're concentrating this pressure around the whole forearm and at the elbow. When I first was taught in the Navy, we just molded up here. That's all we did. Take our big old hands, we cup the condyles of the humerus, take our thumbs, interlock them, and we just squeeze. We didn't think about the interosseous mold at all. I was dealing with young men. I wasn't dealing with 70-year-old ladies. I wasn't dealing with older patients. Well, it's probably fine for them. It worked okay, right? But as you learn, again, I learn something every day. Every week I learn something new. And I've learned. I pick things up. I've seen somebody was putting the 2 stockinettes. They started molding around the forearm. I was wondering what they were doing. I asked them, why do you do that? They told me, because, guess, feel it. Keep molding. And you're going to find if the cast fits a lot better, it's more comfortable. And that's the goal here, guys. The patient to have the correct treatment, to be as comfortable as possible. If you work in a small office, you don't want a lot of cast changes. You don't want the patient back. You don't want to give the patient any condition. You want to give them sores around the elbow. So I'm going to show you this tip here, and one other tip in the future here in a few minutes, about how you protect the elbow a little more. But again, I'm going to really concentrate on this interosseous mold, pressing really hard. What's hard enough? If you watch his fingers, when you press here, the patient relaxes their hand. When you press their interosseous, their fingers will just move just a little bit. That means you're pushing enough. That's how you have enough. But it's pretty aggressive, guys. Remember, fiberglass is very reboundy. It does not want to be flat. It wants to be round. So you really have to concentrate on that mold. Back and forth. Back and forth. If I can get you to catch one thing, is to do this. I don't care what you do up here, in the sense of the stockinets I'm going to show you in a second here, but if you can mold this and get good mold around the elbow, that cast is going to feel a lot better. The patient's going to have a better result. I can guarantee it. So again, around the elbow, squeeze your condyles. Yeah, I'm pressing with my thumbs here. That's going to be cut out anyways. Okay guys, now we're going to go over how to cut the cast or how to mark the cast for cuts. Get an old school Sharpie or whatever marker you want, but you need a marker of some kind. I'm doing this 30 years, I still use a marker. I don't think I'm that good. I need to have the markings, this helps me out. Again, antecubital fossa, about 2 fingers. I want to give a little bit more room there, so I'm not going to be a little bit aggressive on the cut here. I'm not going to try to be too tight to the 2 fingers, but something right there. So I start with the cut mark right there. And now I find condyle. So I know the humeral condyle is about this area here. I want to be above that. So I'm going to go above that, and come down and meet the front cut. Now I want to look at the cast. I literally take my finger, I want to make it symmetrical. So I want to take my finger here, and my finger over here. Kind of look at it. Okay, what looks normal? Make a line, and I'm going to make this round on the medial side now. And then I bring the arm up. Olecraron's here. The cast has to be above the olecranon. It has to be above this. It cannot be below it. So I'm going to have these cuts come down here, come down a little bit here, something like that. Now I know where I'm going to cut. You don't want the wings to be too narrow. You want them to kind of be wide so they're not too thin. If they're too thin, they're going to break down too quickly or too easily, okay? So you want to make sure they're kind of nice and wide and not too low here. Once I do this, I make sure the cast is completely dry. Remember, this cast is getting really, really hot. So if you cut it too soon, you can burn the patient. So make sure the cast is completely dry. It's cooled off. And now you grab your saw and you start to make your cuts on the lines you've drawn. You're ready to go after that. All right, now we're gonna cut the cast. I've drawn my lines. I'm gonna follow my lines with my cast saw. Normal cast cutting procedure, like you normally would do on any patient. When removing the material, you want to make sure you don't pull towards the wings or against the wings. You want to make sure you hold the wings down, pull the material and the posterior part posteriorly, the anterior part anteriorly, okay? You don't want to pull this way because it pulls the material away from the elbow, which we don't want to do. We just molded this way we want to. Now we're going to roll the arm down a little bit here, take our scissors. We're going to trim our web bone. Not a lot. We want to make sure we leave padding for the edges, but we want to make sure we can pull it over the end. And then antecubital fossa, I take my fingers here. I want to leave the edge right here, but I'm going to cut down and cut the middle part out. I might trim just a little bit the corners just so it will bend down better. Now I'm going to use this whole 2 stockinette thing and the stapler. The patient started looking a little weird at this point, okay? But I'm telling you, it works really, really well. So that's down. Here's our first layer. Remember, this is on top of the longer piece. You're going to pull it down. The patient can bring their arm down real quick here. I take this material and I pull it really snugly. I want to make sure it's nice and snug so you don't have any wrinkles in it. Now you have to have pretty big hands or have someone to help you. You take your hand and you hold the stockinette down. That's where that stapler comes in. On the cast material, you're going to staple it. Come to the other end. Right in the middle, a couple more staples. And now you can trim this extra off. If you can kind of appreciate this really nice and snug around the elbow here. Now our second layer, we're going to pull on top of the first layer. Why do we do 2 layers? If you're a hiker, I don't know if you are, but if you're a hiker, you always wear hiking socks. And you know, wear another pair of stocks along with them. What happens is when you have the shear point between the two materials. So the idea is here is their arms moving back and forth, the shear point between the two pieces of stockinette and not in the skin. Again, it's a theory. It doesn't hurt to put two related stockinette, so I figure I'm gonna go ahead and do that. Again, pull it nice and snug down, grab my stapler. On the other side, staple down the front, cut my excess material out. Now I check my cast. I ask the patient to touch their nose and try to extend their elbow. It should be about 60 degrees. You see how it's pushing back here? You need that back here. If you have the cast too low, they'll be able to extend their arm too much. It should be about 60 degrees. He's about 60 degrees. Then I check pronation and supination and try to ask them to pronate and supinate. They shouldn't be able to do much at all. Well, have a little bit, but not too much. That's this mold across the forearm and the elbow. Again, the idea of the cast should be able to touch their nose, feed themselves, not be able to extend all the way, but prevent max pronation and supination. That's the goal of the cast. At this point, I would go ahead and roll my express fiberglass here to incorporate the stockinette and the staples. So now we have the cast cut. We checked for flexion and extension. Now we're going to finish off the cast with our last roll of 2-inch fiberglass. Again, I'm going to start up here where I made my cuts. I want to make sure I secure the stockinette down. You cannot get all the way up here in the elbow. You can go as far as you can to protect the material, but you can't get all the way up there. But you get as high as you can. And then you come down your wrist, your forearm, and finish the cast off. So we talked about the two stockinettes. Remember the history of this cast. This cast used to be used for patients prior to doing a lot of surgeries. What happened, the patient would be in a cast for a long time, especially older patients. And their concern was they would lose motion at the elbow if you casted the elbow in a cast for too long. And so the idea is this gets early elbow motion, but still prevents that pronation and supination. So you have to really be concerned, because now they're starting to use it on younger patients. Well, older people don't have much lower demand. They're not going to be moving their arm as much. They're not going to work. Well, now be a younger population, they're putting these casts on, and you have to really be concerned about the constriction at the elbow or the rubbing at the elbow. So I really pat it really well. I use a double stockinette, and I really tell the patient, this is what you still have to monitor your use. This is not going to be full-on use. And then let them know. If these start to break down, you start getting rubber in your sores, you need to come in sooner and get the cast looked at. But what I found with the extra padding, the 2 layers of stockinette, the molds down the forearm, I really haven't had too many issues with the elbow since I've done those things. But again, that was talking to my fellow techs, getting techniques from them, and learning as I go. Okay, that's what we're trying to do for you today, is give you techniques that you can use for future. You can share it with people you know, and make our patients feel a lot better, and make a better cast. That's the real goal of these videos, okay guys? Hope this helped you out. Put good casts on, take care of your patients, be good to yourself. Thanks a lot. So for conclusion of the Muenster cast, I know a lot of people may not have a stapler in their facility, but again, remember what I used was 1/4-inch staples. Really important, not very deep staples. They're very shallow. If you don't have a stapler, it's not the end of the world. You can still use regular tape. You want to pull that stockinette back and use a tape, it's fine. You can use tape as well. I find the stapler is a lot easier to use, and I think it functionally holds the cast back a little better, but you may not have that, tape is fine. Secondly, I just want to kind of hit some points on this cast. That double layer stockinette, like I talked about before, it kind of takes to that shear point. Okay, that's the real goal here. All your shoes, your hiking shoes, come with 2 layers of padding inside. When you hike, you use 2 layers of sock. That's where that idea comes from. And that mold against the forearm, I can tell you, I didn't do that before. I was just putting molds around the elbow the way I was taught 30 years ago. I thought it was great. And then I've seen people doing other things. We started doing with younger patients. It really makes a difference. So if you can really do that forearm mold, get a good elbow mold, I think that's really going to be helpful to you, the main part of that cast. Pulling that stockinette back really makes it look professional, which it's really important to make things look professional. I can really tell you guys, 2 people can put the exact same cast on, but the way you treat the patient and the way the cast looks, the patient will get a different feeling of outcome than they will from the other person. So if I can tell you, if you have a confident attitude, a professional looking cast, the result will be different. It's just the way it's going to be. So I can tell you that right now. So that's what I try to push out there. Confident attitude, know what I need to have, be prepared, and then give a professional looking cast. And I think the patients are going to really, they're going to feel that from you, and they're going to know that you're trying to treat them properly, but secondly, they're going to give them a good product. And then they usually wear the cast longer, they complain less about the issues of the cast, and you get a better cast. It is a better cast, so that's the goal here. So I hope these tips helped you out. Again, I want you to go forward, I want you to do a good cast and take care of your patients. Have a great day.